Arizona is in the midst of an opioid epidemic. Governor Doug Ducey signed an emergency declaration this morning as he addresses the growing number of opioid overdoses in the state. Last year, nearly 800 people died of an opioid overdose. That's a nearly 75% jump in just 4 years. The hope is today's declaration will help in that fight.
The declaration allows for information sharing, so we'll be able to look into whether their prescription, whether it is illegal, did they get a prescription recently that increased in dose? Did that put them at greater risk? Are they on co-prescribed drugs that put them at a greater risk for death? We'll be able to get into all of that data.
With this declaration, the Arizona Department of Health Services will be looking into ways to improve prescription practices in an effort to save lives. The Arizona Department of Health Services will report its findings to the governor by early September. Efforts will be coordinated between the state, local, and the private sector. A health emergency operations center will open this afternoon.
In a follow-up to Hooked RX, our 30-minute documentary on the prescription drug crisis in Arizona that aired in January, the Morrison Institute and Cronkite News conducted a poll in March representative of the state's population and demographics. They asked Arizonans about their experiences with prescription opioids. And many Arizonans believe these drugs are easy to get. Almost 60% say that it's either very easy or somewhat easy to access prescription painkillers. Nearly 11% said they got a prescription for an opioid from more than one healthcare provider. That would include drugs like hydrocodone or OxyContin. And ongoing pain is also a problem for almost 30% of adults in Arizona. How they deal with that pain varies. 35.8% said they use prescription painkillers. 37.5% answered other. That could mean marijuana, physical therapy, massage, or a number of other alternatives. Cronkite News reporter Lily Altevena asked people in the trenches of the battle against prescription opioid abuse about what these stats mean.
And then one day, when our older son was a teenager, we got a phone call from a woman that was a parent of one of his friends.
It's the phone call every parent fears.
Your son is potentially going to overdose. And we're just like, you must have called the wrong people. This that has not going on here. I mean, not your son is smoking, your son is, we saw your son with drugs. It's like your son is going to overdose.
A wake-up call for Kim Humphrey, a father who never thought his son Sean would struggle with drug addiction, let alone both of his sons.
It was his friends' parents had left some prescription medication, Percocet, in their medicine cabinet. And the next thing you know, they just thought it would be fun to try it.
In Arizona, 41.8% of adults know someone who has been addicted to prescription painkillers.
There's so much of it out there. They're so powerful, and we're still working on making sure people understand it's not aspirin. It's not to be toyed with.
The numbers show that prescription drug addiction has massive reach in Arizona. And officials say it's up to the state's residents to fight it.
Really, the best way is to dispose of the medication. Take it to a drop box.
Humphrey wants more people to start having frank discussions about drug abuse.
We lost about 58,000 people in the Vietnam War. We're losing more than that every year from drug overdoses in the United States.
Officials want to emphasize how important it is to dispose of prescription drugs when you're finished. Flushing them down the toilet is bad for the water supply. You can take them to drop boxes across the state.
Cronkite News is dedicated to covering the opioid crisis in Arizona and nationwide. Our documentary Hooked RX, From Prescription to Addiction, highlights the problem of painkillers here in our state. You can watch the documentary and find resources for getting help online at hookedrx.com.